pressure may mount on Duale to take responsibility for SHA deception mtu wangu wa power, and then tumekuwa na Rupa ama ni Rufa ikiclaim that SHA laxity may allow fraudulent hospitals to steal funds, na hizi funds of course ni za taxpayers mtu wangu wa power. That's why this particular moment we are being joined by Reverend Joseph Karaoke, who is the vice chairperson of the Rural and Urban Private Hospitals Association, Mtuangwa Pogpenda RUPHA. Is the situation this dire and this messy when it comes to actually the entire SHA system and also the SHIF system?
Yeah, the situation is not very good. Especially from the provider side of view.
Providers, these are hospitals now.
These are hospitals. Yeah, the situation is dire, like you have said.
Yeah.
Because from the provider point of view, SHA is a big problem. And in the setup that it is right now, we are not likely to see the good results from SHA.
Yeah. And if you're not going to see good results from SHA, what does our future look like as a country from a health perspective?
The future is bleak as we look at it right now, but there is hope that something can be done if all the stakeholders come together and just agree to work together on these things, because there are good things within SHA, and as providers we have been supporting SHA since inception, and we want to support it. We want to make it work. The best thing for this country is to have a good working health system.
And how do we attain a good working health system from the perspective of this new authority, social health authority, and also the SHIF perspective?
The only way it can work is when all stakeholders come together and review at least the past 9 months of SHA, and be ready to take criticism, suggestions, and other ideas. Because what we have right now is that it's like they are rigid.
Yeah.
The MOH is rigid to take new ideas, to be challenged, and to be pushed to do something maybe that they had not anticipated.
Yeah.
We have issues like collections of premiums. That has been a big issue. Up to now, SHA has not been able to collect enough that will be enough to pay for the bills that are claimed by hospitals. We are doing around 5 billion a month, and the claims are at 10 billion. So even if we run, we can't get to our target. Yes.
Okay. And most private hospitals, and I'm speaking from experience, are not actually providing SHA services. Can you tell us if that's the situation from where you sit as the body that the umbrella body for urban and rural private hospitals? Is that the situation? And what is making these private hospitals become sluggish, or maybe even not willing to actually admit patients under SHA terms?
Why a hospital will be sluggish to attend a SHA patient is simply because of reimbursement. You know, when you see a patient and you put up a bill and it takes either 6 months to be paid or not paid at all. Right now we have that story of 10.6 billion that have been rejected and called fraudulent claims. It is sad that after 6 months after giving service, waiting for your money, then it turns to be fraudulent. So that will actually deny you the motivation to continue seeing patients. Yes.
Do we have some of your hospitals that have been involved, like member hospitals that have been involved in these fraudulent dealings? Do you know of any case where private hospitals that are not either registered or are registered but are fraudulently sending claims to SHA?
Sure. In a sector like this, you would expect. Within RUFA, we say not all of us are dressed in white, meaning there are those who are among us and they're not doing the right thing. But that will not be the reason to throw the baby with the bucket.
Yeah.
No. There are better ways of handling fraud issues. We have a 104 billion system that was procured. That system is supposed to help us, detect fraud early enough and take action. But the idea of rejecting a claim at the point of payment, that is what we are feeling not very good for us.
And how are these fake hospitals, for lack of a better word, managing to crack through the system and get payments or get their claims sent to them, yet they offer nothing, and those that are actually attending to patients end up not being actually paid their dues? How is this happening? You speaking as maybe an insider or someone who is privy to what's going on in this particular system.
Actually, you said it. The only way that ghost hospitals can find their way into the system is through the government. It's through the Ministry of Health. It is the Ministry of Health through KMPDC that registers and licenses health practice. So nobody can start practicing if they have not gone through those. There are mechanisms that you go through for you to be registered and to be licensed. So how they find themselves into the system cannot be sorted by RUFA and any other facility. Can only be sorted by government. And I can give you a few examples. One of the loopholes that we have noticed as providers is that there was defunding of the KMPDC. Defunding. The national government no longer gives KMPDC money. And from where we sit, we see that KMPDC, having been defunded, is looking for ways of generating income. And so anybody lodging some application for a hospital, they end up just taking the money and giving the license. They don't have enough money to have staff in the counties and in the regions where they can go and inspect and follow up to know whether this facility is there or not. A simple report from the public health office in a county will give you a license for running a hospital at KMPDC. So for us, we look like they are rushing to meet their budget gaps, and as a result, they expose the country to these ghost hospitals.
And what's the situation like from a patient's perspective? Are people hurting out there?
People are hurting definitely, because one, if ghost hospitals collect all the money like you have seen in the recent past, then the genuine hospital are not paid. And if the genuine hospital are not paid, then it means that local mwananchi there will suffer. The provider will suffer, because when you look at the provider, you look wholesomely. You look at this as a business entity. You look at an institution that has employed people. Families are depending on this. You look at an institution that pays taxes to KRA. You look at an institution that is supporting an ecosystem within health. There are suppliers supplying consumables to the hospital. All this is strangled because a ghost hospital somewhere has collected money for which the genuine hospital was supposed to get. And so we will keep on closing. In the last 1 year, we have closed. We have seen 100 hospitals closed.
Under your, these are your member hospitals?
Under our membership. Yes.
100.
100
over
plus
the last.
Over the last 1 year. And simple reason, they are not able to operate. There is no cash flow. They are not able to sustain their staff. They are not able to pay their rents where they have rented. They are not able to pay the suppliers that have supplied consumable to the hospital. Every day, the issues that we handle in our office are more like the hospitals have been taken to the small courts. The suppliers have pushed them there. Staff have taken the hospital to the labor courts. They have not paid salary for 3, 4, 5 months. I mean, those are the things now we are handling. And it's as a result of these ghost hospitals that have been registered.
How much membership yenyu under RUPA? How much are you claiming from SHA as we speak?
As we speak, let me give you a figure for the entire providers. It's 43 billion.
Entire meaning both public,
faith-based, and private.
43
It's
billion
43 billion,
worth
of which
pending
pending,
claims.
within SHA.
Uh-huh.
Within the 9 months of existence of SHA,
Yeah.
43 billion is being owed.
Uh-huh.
And 60% of that is from private sector.
60%.
Yeah.
And right now, you're saying private hospitals are now hesitant when it comes to admitting people under SHA programs.
Oh, sure. And we have said we've given the ministry time to reorganize the house. In the coming days, we'll be calling a special general meeting for our members to decide on our way forward, because it is becoming unattainable to continue offering service under this environment. Yes.
So are we better off under SHA, or should we just have panel beat the loopholes and the problems we had under NHIF?
A good question, but I think we are past that.
Yeah.
At the moment, we should just work on how to improve SHA. We are past NHIF, because again, we can't compare mangoes with oranges.
Yeah.
Let us work on SHA. And like I said earlier, the best way is to have all stakeholders sit down. Yeah. Don't look at this group of people as your critics and then you sideline them. Like the wise man would say, keep your friends closer.
And your enemies.
Your enemies closer, is it?
Yeah.
And that is what you should do. If I find you as my critic, and of course there is a national outcry that the system are not working, you are the person that I should bring closer.
Have you tried to reach out to MOH? Have you tried to seek audience with them? And what has their response been like?
Truth be told, we have even written a letter to the CS requesting to have a sitting with him. That letter has gone unanswered for months. Yes.
And what does that make you feel?
Not very good, of course, but we can't stop doing what we are doing. We are committed. We have an obligation to offer service, and that's what we are committed to do. Yeah.
Should they not respond to your letter? Should they not sit down with you guys? Tell us, from a private hospital's point of view, what will be happening soon?
Look at it this way, that yes, that's a hospital, but it's a business. And any business person will try to strategize on how to stay afloat. So we will be forced to strategize on ways that we can employ to make sure that we keep running. Because if we don't, then we will close shop. And for your information, private sector provide 51% of the healthcare in the country.
Private hospitals?
Yes.
51%. Yeah. How about those who've been lucky enough to be attended to under SHA program? Is it a smooth kind of engagement, or do we still have gray areas in as much as SHA goes?
Yeah, we still have some gray areas, but the best part is that the process completes. For a patient, once they come to the hospital, they are registered, they are verified, we check their eligibility, they go see the doctors, they take their test, take their drugs, and go home. And that's a good thing. But, like we are saying, it is only smooth for the patient. That is why when you ask out there, is SHA working? Somebody will tell you, yes, SHA is working, because I went to the hospital, I was treated, and I went home. But if you ask the provider whether SHA is working, they will tell you no. Because when we did our part, we were not reimbursed. So that question actually depends on who you are asking. Yeah.
Okay. Just the other day, former Chief Justice David Maraga weighed in on the matter, and he urged the EACC to investigate and take firm action against those responsible. Do you think there's willingness for those actually who might be termed as perpetrators of this fraud to be brought to book?
It just happened like 2 days ago or something, so we are yet to see much of what the government has done. But from where I sit, if there is someone who worked in a government office and registered a facility, that person is traceable. So it shouldn't take the government so long to have these perpetrators brought to book.
Yesterday, we saw figures where Kenyatta National Hospital, the biggest facility, maybe in East and Central Africa, received under 100 million worth of paid claims. Yet we had a hospital, I think privately owned, that received so far over 220 million Kenya shillings.
As a country, we procured a health system
Worth
to run
100,
SHA,
yeah,
104 billion shillings. I think even e-citizen that we used to do all other services did not even go a third of that. This system was supposed to help us run end to end without human intervention. It was supposed to run the processes of claim management. It was supposed to run, to detect fraud. It was supposed to do a lot of things without human intervention. And what did we say? At a particular point, it is deliberately stopped. And a few people sits in a room like this one and it decides which hospital to be paid and how much to be paid. The natural, equitable way of payment will be first in, first out. We would want to see the hospital that lodges claim first is paid out first. That will be most equitable.
Yeah.
But what are we seeing today?
Yeah.
That system has never produced the results that was intended.
Yeah.
We are still having a lot of human intervention within the system. And that is why we are not able to have a smooth service in healthcare.
Yeah.
Much more to it is that the system is not even hosted at SHA. It is hosted elsewhere. So SHA actually has no control over the system. And my contract is with SHA, not with the other agency.
Yeah.
So if I have issues, SHA cannot sort for me because they don't have a hand on it. And that is what the former Chief Justice Emeritus was talking about.
And you see, 104 billion is not kidogo money.
It's a lot of money.
Because projects like the Burj Khalifa, the Dubai Land, and One World Trade Centers cost just around that amount.
Sure.
And yet you can see the economic impact that comes with all these mega projects. Yet ours, even a year is not over since its establishment, and here we are. Your final word as we wrap up this interview, Reverend.
My final word will be this. And let me be current on what is happening now.
Yeah.
The fight against medical fraud. It cannot be won with the strategies that are being employed by MOH at the moment.
Yeah.
You can't be kicking everybody left, right, and center because you are looking for a fraudster. You must be deliberate. You must be intentional. You must have a plan. You must not cause the genuine provider to suffer when you are pursuing the wrong one. I would just say that we need to have a structured way of dealing with graft. For example, we can't talk to them what we have not done. At RUFA, you can't join membership unless you sign an anti-fraud policy that RUFA has created. And as far as I'm aware, RUFA is the only association that has publicly made its anti-fraud policy document public. We have even registered it at EACC. They are aware this is what we do, and every member coming must sign. The same thing should happen with the government, that all this fight against corruption, first, it must be time-bound. You can't be fighting corruption forever.
Yeah.
You must say, within this period, we have flagged these facilities, and we have evidence, we take them to court. Right now, since we started making noise about fraud,
No one has
been brought to book. And even for this hospital that was suspended, when an audit was done to these facilities, the information or the evidence that was gotten cannot stand in a court of law. So we made a lot of noise. We defamed the facilities and their business entities, and yet we did not come out with anything tangible.
Thank you very much.
We want to see the fraudsters arrested. For example, the ghost hospitals that are in their list, those ones are supposed to be in court right now.
They should be shut down.